I really want to sing the song Jump by Van Halen. Remember that song? It was an awesome song. I really do. But you have spoken in surveys and said, I am forbidden from singing on the show. Nicole is the gatekeeper and she will not let me. So I will not sing it. But we will talk about Medicare mistakes in retirement this week on the Retirement Answer Man Show. My name is Roger Whitney. I am your host, and this is the show dedicated to helping you not just survive retirement, but to jump. Go ahead and jump into retirement and rock retirement. And this entire month, we are focused on the Medicare decision with our resident expert, Danielle Roberts from Boomer Benefits. And we're going to talk to her about common mistakes that people make in Medicare. And then we're going to answer some of your questions because this show is all about you and helping you rock retirement. So we want to make sure we understand what's on your mind. But before we do any of that, let's get to the What Does That Mean segment so we can talk about, not sing, but talk about jumping.
Huh? What does that mean?
If you look at the definition of jump, there are two that stand out to me. One is to move suddenly and quickly in a specified way. The other is to push oneself off of a surface into the air using your resources, your legs mostly. Wow, retirement sometimes feels like jumping. It feels like a sudden thing. One day you're going to work and the next day you're not. I was having a conversation with Debbie in the Rock Retirement Club last Friday. And every Friday I have office hours where I have one-on-one conversations with anybody in the club that wants to chat with me. And we were chatting about some decisions and how to think about them. But we also talked about one of her hobbies, which is hang gliding. And she said, Roger, there are a lot of parallels that I see in my mind of hang gliding and retirement. And I didn't really know what she meant. So I had her talk to me about what she does in hang gliding and how she got into it. And she's right. There are a lot of parallels to hang gliding and retirement. At the point of deciding to actually do it, you have to jump. In hang gliding, you literally jump off of a mountain. In retirement, you jump in the sense of giving your notice, going to your last day of work, and then you are suddenly thrust into, voluntarily most of the time, a whole new world. In hang gliding, it's floating in space, lifted by air. In retirement, it's total life freedom, being lifted by the resources that you've built over decades. It's jumping. Maybe that's one of the reasons why it's scary to make the decision to retire for a lot of people. So they continue, sometimes for years, with their feet on the ground of work. So as I was talking to Debbie, we walked through, because I was like, oh, this is interesting. So we're talking through all the things you have to do to become a hang glider. You have to get training of, okay, how do you actually do hang gliding? Makes sense. How do you create a paycheck, I guess, in retirement and things like that? You have to get the right equipment to hang glide. You want to get good equipment. You don't want to chintz out on the thing that's going to hold you up. That could be your investments or your allocation and so forth. She said, you learn from experts, you go get training on how to actually hang glide. Probably a smart thing if you're going to jump. And you learn from others that have done it, which is a lot of what the Rock Retirement Club is. There are people in there doing retirement really well. Why not surround yourself with those kind of people? And then she said, once you get the training, you get the right equipment, you start to learn from people that have been doing it, you practice on small hills. And I didn't even think about this. My mind was, well, how do you take that first leap off the mountain? And she said, well, Roger, you don't. You have these little training hills that you hop off of. And then you go to a bigger training hill and a bigger training hill. And it occurred to me when I go to Nags Head, North Carolina, I see people doing that on the sand dunes. And I imagine in retirement, training hills might be living on the retirement budget that you're planning or going part-time work or pre-retirement. And then you work your way up. Let's think of the day of going to hang glide and how it parallels with the day of, or the time frame of going to get ready for retirement. First off, you got to check the conditions. Are the conditions right for hang gliding or retirement? You got to recheck your equipment. You don't want something to fail after you jump. You got to recheck your equipment. You have to choose your location based on your conditions and your equipment, so you get the timing and everything right. You got to get ready. You got to get up there. And then in hang gliding, because I was thinking jumping, she said, no, you got to run. You run towards the edge and then you jump. Well, in retirement, when you start to put all this together and you give your notice, that is you running towards that last day, and you got to get everything placed. And then you ultimately have to jump and actually pull the cord and do it. A lot of good parallels there. After you jump and you're in the air, whether it's in retirement or hang gliding, you have to constantly monitor the conditions and take advantage of good conditions, or I guess wind currents. Because if you jump into good wind conditions, you can go experience more. If you jump and the conditions change or you get bad wind currents, you have to adjust for those bad conditions. So you got to monitor all that constantly, not just once. And you constantly have to plan ahead, good conditions or bad, for your landing. Because like in retirement, hang gliding, you get one shot at the landing. So that constantly has to be there. But the whole point of the exercise, while you're doing all this monitoring, good, bad conditions and everything else, is you have to enjoy the freedom. That's the whole point of it. Why hang glide if it's just managing? The whole point of hang gliding, I imagine, is the freedom, the time freedom, to be able to ride different currents based on conditions and what you are excited about. None of this happens, though, unless you jump. Thanks, Debbie. That was really helpful for me and hopefully for you too. With that, let's go talk about Medicare mistakes. Danielle Roberts from Boomer Benefits actually has a book coming out on September 24th. We'll have links to it in our 6-Shot Saturday email, called 10 Costly Medicare Mistakes You Can't Afford to Make. So we're going to talk to her about Medicare mistakes. And we're going to go beyond the book and some things that she didn't get into the book, because I'm sure there are more than 10. And we'll have links to the book in 6-Shot Saturday. And as a reminder, if you're a member of the Rock Retirement Club, we have her coming in as a special guest on the 28th of September to answer your questions. So I've been getting a lot of questions. We'll answer some that have come in from the show. So this is our chance to talk directly with her to get answers to specific questions that we have. So it's a great book. And with that, let's talk with Danielle about mistakes in Medicare decisions. Wait a second. I always forget this. We're going to have a handout related to this that she's providing us that we're going to send to you for free in our 6-Shot Saturday email. So if you're signed up for our 6-Shot Saturday email, which is just a weekly email we do with quick tips on how to retire and rock it, great. If not, you can go to rogerwhitney.com and sign up for 6-Shot Saturday there, and we'll send you these free resources. Now let's talk to Danielle. So today, Danielle, we are talking about mistakes. Lots of mistakes that we make in obviously Medicare planning. Really, you can't make a perfect decision anyway. But before we do that, I'm going to throw you a curveball. Okay. Because I had a question from a listener, James, and I started to do on Medicare, and I started to do all this research to make sure I had a good answer. I'm like, what the heck am I doing? I have an easy button. I'm just going to ask Danielle. So I'm going to play, because he recorded it audio. So I'm going to play his question and then put you on the spot.
Terrific.
You think you're up for it?
I think I can handle it.
If not, I'll just redo it. So don't worry. I got you covered.
Okay.
Hold on. I'm going to play his question.
Hi, Roger. I'm 67 years old. I retired in June and signed up for both Part B, the medical insurance, and Part D, the drug plan insurance with Medicare. I was notified by the Social Security Administration that I have an income-related monthly adjustment, or IRMAA, for both Part B and Part D. I understand Part B, IRMAA, but I don't use the Part D drug plan, but use a free prescription savings card. My question is, if I drop the drug plan insurance, will that eliminate the IRMAA? Thanks, Roger.
So, Miss Medicare expert, what does he do about Part D in this IRMAA thing?
Yeah, this is a really good question. And it just goes to show you the complexity of some of the situations that can happen with Medicare. So one piece of good news would be that if you don't enroll in Part D or you drop Part D, you are no longer subject to any IRMAA that applies to Part D. So sometimes if we have people in a very high income bracket and they're going to have to pay an extra $70 a month on top of whatever their Part D premium is, they may decide to forego Part D, especially if they have access to other drug coverage, like through the Veterans Administration, something like that. The downside, though, just to keep in mind, is that later on, when you decide to re-enroll in Part D, there's two things you have to think about. One is that you have to wait until the next election period to be able to get the drug coverage. So let's say it's February and you get prescribed an oral chemotherapy medication that is $5,000 a month. Now you can't get into a drug plan until the annual election period at the end of next fall, with that plan beginning in January. You can incur some pretty big spending on some of those more expensive drugs like that. And then they'll also whack you with a penalty when you rejoin the Part D, and you will pay 1% per month cumulative for every month that you could have had Part D, but you did not. So let's say you were without Part D for 5 years, that's going to be a 60% penalty, and they assess that on top of the national average base premium for Part D. So the longer you go without it, the higher the penalty gets, and you pay that penalty every month for the rest of your life or however long you're enrolled in Part D. So you have to think through all the angles on that one.
My initial thought as you said that, I guess you just got to suck it up, Buttercup, and pay the IRMAA on Part D, because that sounds pretty drastic.
Yeah. And most people do.
Yeah, I could see that being a big mistake, right? To sort of save the
Yes.
IRMAA now and then realize a year later that, God forbid, something happens where you need high dollar prescriptions and you basically
don't have adequate coverage.
Yeah.
And a lot of those discount programs are great for generics, but then when you get to the brand name drugs, the discounts are not significant. And so you're kind of just paying out of pocket for those more expensive medicines if all you're relying on is a little subscription or discount or GoodRx or something like that.
So James, your question was actually a good question to start this, because that could be a potential bigger mistake if you don't think things through and ask questions and try to find experts like Danielle. I was researching that and I wouldn't have got that second part of it. Well, we hadn't found it yet, that penalty part, because that's a pretty stiff penalty for the rest of your life. So your new book, which is coming out, in less than a week now, Saturday.
I know. Woohoo, it's exciting.
It's very exciting. I guarantee you, as soon as it's published, you'll find that one typo that you've looked for forever. I know that happens.
Isn't that true? Oh, you go through it so many times trying to find them, but I'm sure there's a few we missed. So forgive us if we did.
Yeah. And your book was it 10 biggest Medicare mistakes that people make?
10 costly Medicare mistakes.
Thank you so much. So 10 mistakes. We're talking about mistakes. So we're going to have those in the book, and we'll have links to the book in 6 Shot Saturday. And again, you're coming into the Rock Retirement Club to answer specific questions, I think on the 28th, which is fun. But let's talk about mistakes. What is it that you see that people should be aware of?
Sure. So if you're really new to Medicare or you're a few years out from it, by far the biggest mistake that we see repeatedly is people waiting until they're 64 to learn anything about Medicare, and then suddenly finding out that it's not free like they thought it would be, and that they pay their share of the expenses with deductibles, coinsurance, and copays, just like they always have during their working years. And if you didn't know that, let's say your financial planner wasn't so awesome to hold 5 Medicare in a row sessions on the podcast and bring this information to you so you knew this ahead of time. If you didn't know that, and we meet these people all the time, they literally find out at age 65 that they didn't save enough for retirement because they didn't realize that 10% of their Social Security check would be for Part B, and that they also have to pay for Part D, and they have to afford a supplement. And on top of that, they've got copays for prescriptions, and all of this stuff can really gum up the works if you were anticipating having X dollars a month to spend in retirement, and now you've got to spend some of that on healthcare expenses. So obviously the name of the game is to start your research early and to plan for those healthcare costs in retirement, and also to learn about the things that Medicare doesn't cover, such as long-term care, dental, vision, and hearing insurance, which are also things we all have to plan for.
Okay. I mean, that's amazing that I guess you don't think about it. You just know Medicare's out there and you all of a sudden, I want to qualify. I shared a comment and I wanted to get your comment on the comment from someone on the show last week on Medicare and employer coverage. And she said that her husband managed a PERT, a public employee retirement system. And that sometimes when you sign up for Medicare or you opt out of Medicare to go to these plans, you can mess up your coverage. And they said they had a whole staff that worked on undoing some things that people did when you combine employer type plans, especially public ones with Medicare. Can you talk about that a little bit?
Yeah. So Part A, your hospital coverage, is free for most people because you've paid 10 years in your working lifetime into the system so that the trust fund can then pay out your hospital benefits. But there are some jobs out there, and this is more common in the past than it is today, but pension plans, things like that, where people sign up and they're not paying those FICA taxes. So we see this a lot of times. There are teachers' unions out there where they never pay FICA taxes that come out of their checks. So they're not contributing toward their future Part A benefits. And they get to the point where they're eligible for Medicare and, oh my gosh, I'm going to have to spend $400+ a month now for Part A, in addition to what I pay for Part B, Part D, and a supplement. And that could really hurt you. The good news is maybe you didn't contribute, but you're married to someone who did. And if that person had paid their FICA taxes, you can get your Part A for nothing based on their work history. But over the years, we've met people that just didn't realize this, or kind of like what you said about Social Security and Medicare are kind of vaguely out there somewhere in the future, and we don't always pay that much attention. And we don't realize how some of our decisions today could really affect those benefits tomorrow. So that does affect some people. And we also see people paying the Part A premiums if they've just been in the US a short time. They have maybe only been here 5, 6, 10 years, and they haven't worked all that time, and they didn't have the time to contribute. And then they end up paying for those hospital benefits.
Yeah. I mean, these are things that come back to get you. So what would happen if you're a teacher who is not paying into the system and you were married 15 years ago, but been divorced for 15 years? Can you go back to your ex-spouse's record?
Yeah, you can. So if you were married, I think it's if you were married to that person, if it's an ex-spouse, there's a period of time, it might be 10 years that you had to have been married to that person. So if it's your current spouse, you only have to have been married to them for a year.
Okay.
But if it's a former spouse, you have to have been married, I think, 10 years. But you can go back, and if that person did the contributions and had the FICA taxes, you can also claim on their work history. So it gets pretty complicated. You have to look back over your life and say, there's someone that can help me qualify.
This is always the problem I have in planning with rules of thumb of any sort, right? Because they're great as rules of thumb, but the specifics can get you in sometimes good ways, but most of the time it doesn't seem like it is. So give me another horror story. I like horror. It's like Halloween. This is like Halloween. These are Medicare horror stories.
So in relation to the question that you asked earlier, I kind of commented briefly on, you never know when you're going to get sick and you don't want to be stuck with a medication. That little warning is based on a true client story. One of the clients I had very early in my business. So Part D came out in 2006. And I remember meeting with this client, and it was my second or third office that I was in the growth. You know how you think back over the places you've held your business. And she came in with her son, and she was very healthy, and we signed her up for a Medicare supplement. And I remember there was a drug plan. It was like $11 a month. And she didn't want to spend that because she didn't take any medications. So she said, I'm not going to sign up for the Part D right now. And we went over the penalty and everything, and we explained the risk. And so each year we would touch base with her. Are you ready to sign up for Part D yet? And finally, what happened was one year she called in and she said, well, Danielle, I think I finally am figuring out why you keep telling me every year I need to enroll in Part D. And I was like, oh no, what happened? Well, this was in September, and she actually had been diagnosed with cancer and prescribed a drug called Gleevec, which was over $5,000 a month. And because it was an oral chemotherapy med, it was falling under Part D instead of Part B. And there's some tricky rules about that. And so she spent $5,600 per month from September, October, November, December, until she could enroll with me for a drug plan to start on January 1st. And that all happened because she didn't want to spend $11 a month on a Part D drug plan. And so one of the things I tell people, and this is in the book as well, one of the mistakes is skipping your Part D coverage. That's just one example, one of the more extreme ones that I can give you. But there's all sorts of drugs out there now for autoimmune conditions that are very, very expensive. Diabetes medicine is expensive. And I always think, what would have happened to her if that had happened in February and I couldn't get her in a drug plan until the next January. So even if you don't take any medications, enroll in at least the cheapest plan. My dad is a Vietnam War era vet and he has VA coverage, and I still bought him a drug plan because I know that even though he can get his medications very cheap through the VA, there's a lot of brand name drugs that they don't cover. And sure enough, 2 expensive diabetes medicines that would have cost him over $700, he was able to get on his Part D plan for $41 each. And those are the things that you just don't always know to think about. And people always think it won't happen to them, but it does happen to people every day across America. And Part D, you can always find a plan in your state that's really inexpensive. Some of them are $10, $15 a month. And even those plans, they all have standard parameters. They have to cover 6 classes of medications, including anti-cancer medications. So even if you enroll in one of the cheapest plans, you're going to have access to those big, important medications if you need them. And so when we got her enrolled in the Part D plan, the next year, she spent about $5,000 because she went through the coverage gap and out the other side right way early in the year. But then thereafter, that medicine cost her $300 a month for the rest of the year, which is not great, but it's a far cry from $5,600 a month. And so you want to always be thinking about, I might not be in the same health tomorrow as I am today. What things should I have in place so that I don't have medical bills complicating the fact that I might be trying to heal from something?
Yeah, and this is actually a risk management exercise as you're talking about it, right? It's like, okay, what is the risk, right? The risk is I'm going to have to pay for a prescription. What's the severity of the risk, right? And the severity depending, cancer or psoriatic arthritis is another drug. My wife's on Humira, which is $6,000 a month.
Ooh, yeah.
What's the severity of the risk? And what's the time frame of the exposure? Because you're making this decision when you're 65. But you're not making it for your 65-year-old self. You're making it for your 70-year-old self, your 80-year-old self. Mm-hmm. And then what's the cost to transfer the risk? In this case, it was $11 a month. Yeah. It's easy to be the penny wise, right?
Yes.
Well, I have a question related to this is, if I sign up for the least expensive Part D, what happens a year later if I want to upgrade? How does that work if I'm already in Part D?
Yeah. So every year in the fall, you're going to have an opportunity to change your plan during the annual election period, which runs from October 15th to December 7th. And something your listeners really should know as well is that the plan that you're on, even if you love it, it's not going to be the same next year. They're going to change things. They'll change the premium. They'll change the deductible. The copays may be different. You might have a drug that goes from a tier 2 to a tier 4, which is a significant jump in what you pay as your copay. They might drop medications from the formulary. And so in September, you're going to get an annual notice of change packet from your Part D carrier. It's going to lay all those things out. And let's face it, nobody's excited to get Medicare mail, right? That's not as exciting as a card from your family member or your grandchild. There's other things that we get that are more exciting.
A package from Amazon. That's exciting.
That's right. Oh, those are the best. I love those. So you could put that little packet aside and not be thinking about it. And then you won't know until January when you're standing at the pharmacy counter and the pharmacist is quoting you $400 for a medicine that cost you $45 before, and now it's too late. So sit down with your packet every September, review it carefully. And if you don't like something, you have the opportunity to change. But even if you think it's fine, it never hurts to log into your mymedicare.gov portal. You can sign up for mymedicare.gov. It helps to track all of your claims. But there's a plan finder in there where you can enter your medications. And each year, all you have to do is log in and update anything that changed, hit the button, run a new set of quotes, and it will compare your current drug plan and your annual spending on that plan for the cheapest plan in the area. And so if you're still on the one that's the most cost effective for you, great. But you could be overlooking a plan that would save you $500 a year, and you would miss that if you just didn't check it every year. So you should always spend a few minutes searching. Yeah. Take a few minutes and do it every fall. We're always amazed. Sometimes we find really big savings for people. And it's just because one plan changed something or they added a drug to a formulary at a different tier than what our client is paying on the one they have. So
that's an excellent point. And then how does it work if I'm in the lower tier, but I want a better plan? Am I penalized for that if I don't get the better plan at the beginning?
Nope. So because all the drug plans are standardized, you can change to a plan that's more expensive. You can change to a plan that's less expensive. And when you say upgrade to a better plan, that's a subjective term too.
Yes.
Because your plan that has, let's say you find a plan with no deductible. So they're going to waive the deductible for you. Well, you're going to find when you look at the copays on the medications on that plan that they're more expensive than the one that had the deductible. So that's why it's usually good to use the Plan Finder tool, because instead of sorting just by the premium, you can sort by the total overall annual out-of-pocket cost for you specifically with your specific medications. And that's the number you want. What am I going to pay for everything? My plan, the deductible, the coverage gap, my copays, that annual number. You're looking for the plan that offers you that lowest annual number. And then when you find that plan, or let's say you're looking at the top 2 to 3 plans, they're going to be the least expensive for you. Dig into the details a little bit. Maybe one of them has all 3 of your medications and there's no restrictions on them whatsoever, but the other one has a quantity limit restriction on one medicine and it has a step therapy limit on another medicine, which is when they want you to try a cheaper drug before they'll fill the more expensive drug. Well, those are hassles for you. And so if you have plans and they're relatively equal in price, but one has less hurdles for you, that's also something important to look at.
You're so awesome. This is really important stuff.
Well, thank you.
Okay. One more mistake you want to talk about?
Yeah. So let's see, which one should we choose? I'm going to choose the one that is my biggest pet peeve, because I feel like the government perpetuates this problem by using the term open enrollment for too many different things. So if you had an open enrollment period, that sounds like you can go and change to another plan, and that would just be very simple and you wouldn't have to think about much else. And there is an initial enrollment period for Medicare. You have a Medigap open enrollment window, and then there's the open enrollment period that happens every fall. I call it the annual election period on purpose to make it different for my clients. October 15th to December 7th, there's a Medicare Advantage open enrollment from January 1st to March 31st, when you can change from one Advantage plan to another. And there's too many open enrollments. And so people confuse what they can do in each period. But the important thing I'd like people to know is that annual election period in the fall from October 15th to December 7th is for changing, joining, or leaving a drug plan or a Medicare Advantage plan. It is not a free pass into a Medigap plan. So you can't sign up for the cheaper Medicare Advantage and then wait till you get a chronic illness and then switch to the better Medigap coverage when the attic is already on fire. Like I try to tell people, there's protections built into the law so that insurance companies don't go bankrupt from people that would do that. And we all would if that was the case, right? Let's get the cheap thing now and we'll just upgrade to the more expensive thing once we get sick. But because Medicare calls it an open enrollment period, people get that one wrong a lot. So when you first get Medicare, if you join a Medigap plan, you have that 6-month window to get any Medigap plan you want, regardless of any health conditions. And that is your one-time 6-month open enrollment window for Medigap. After that, there's no more open enrollment for Medigap. If you switch, you will have to go through underwriting in most states, Texas being one of them. You want to change from one plan to another, you're going to have to fill out the health questions and they can turn you down. So we see people every year that didn't know this, and now they try to get a Medigap plan and they can't because let's say they do have psoriatic arthritis, or they have multiple sclerosis, or they have a CPAP machine, or they have a stent in their heart. I could go on and on, all the things that would disqualify you. So buy the coverage that you really want up front. Get the plan that you feel is going to serve you best if you get X, Y, or Z dreaded illness. And then if you don't feel like that's the plan you want to stick with long term, you shouldn't be buying that plan. A lot of people will opt for the Medicare Advantage plans because they're less expensive, but then Medicare Advantage plans, you're going to pay 20% for those injectable medications, and they're very expensive. And so you'll end up spending so much more on that Advantage plan, even though the premium is a lot less. And so you've got to weigh those risks against the costs, but it's best for you, at least going in, that you aren't confused about thinking that you could just get a free pass in a future year.
We all like free passes, but You're right. And so this is a good segue for next week when we talk about what we need to organize to make the right decision, or as right a decision as we can figure for ourselves. So we will chat next week, Danielle.
Okay, stay tuned.
So this week, we're going to answer a few questions on financing and renting and a little bit of IRMAA with Part D on Medicare. But if you have a question for me that you'd like me to answer on the show, and we try to get to all of them, but as many as we can, you can go to rogerwhitney.com/ask Roger and leave a voice message. We'll have a few of those today, or you can just type an email and we'll do our best to answer it and give you a framework for how to think about it. So it's rogerwhitney.com/ask Roger. Our first question comes from GC on financing or paying cash. And GC is wondering whether they should pay cash or get a loan for the RV that they're going to purchase. So they've done the due diligence. They know they want to have an RV of some type, and they want to know, should we pay cash for it or finance it? Because financing is readily available, but also extremely inexpensive at these interest rates. So do you finance or not? Well, let's think about this. I'll share a couple of my own personal experiences on this. So we are in the midst of building a backdoor overhang with covered seating area in the backyard. And we started pre-COVID, and it's not inexpensive, right? Those things are not inexpensive. And initially I was going to finance it. So I went and got a home equity line of credit on our home because the rates were silly low. I mean, a couple percent. And I had 15 years to pay it back. And that's a good reason to use home equity potentially, is to add to the house. And so I went and secured the home equity loan. And then they started the project, and you pay in tranches as they finish certain benchmarks. And every time they had a tranche, although I intended to finance it, I looked at it and was like, this is sort of silly. I got the money sitting over there in cash reserves above my emergency fund. Why don't I just pay cash? So I started to pay cash for it throughout the building. And I think I have one more tranche left because it's almost done. So I ended up not using the home equity line of credit to pay for it because I was able to just fund it. Because it seemed silly because I was earning almost nothing on my money, and why finance something and when I got money just sitting there. But I'm still glad I have the home equity line of credit open, because now I have this line of credit that if life happens in some weird way, I can deal with it a little bit better anyway. It gives me options. So the second story is, I was having a meeting with a client about a month or so ago, not even a month ago actually, and we were evaluating, do they pay off their house or do they refinance it? Because they were at a 4.5 or so, and they could refinance it if they did a 15-year right around 2 1/8, and at a 30-year at 2 5/8. I'm showing my age because I'm using fractions. So it was, do we pay it off or do we refi it? And if we refi it, do we do a 15-year or do we do a 30-year? And in that instance, because of their situation, they're retired, and the cash flow streams and how their resources were organized, it made sense to refinance it, one, and it made sense to refinance it at 30 years, not 15 years. It's not because they like debt or I like debt, but from a cash flow perspective, we refinanced it at a 30-year to have a lower minimum payment because it's amortized over 30 years. But the intent is to pay extra on it and essentially make it a 15-year loan, with the option to not have to do that in the case that bad conditions come later in life. And it made sense to refinance it rather than pay it off because of where their assets were tax-wise and how the whole plan was put together, that if they were to pay it off, it would zap a lot of their liquidity and they'd have to go tap assets and pay taxes on it in order to do it. Was it the perfect decision? Either one? No. Regardless of what the decision you make on these type of things, GC, you're not going to get it right because we're dealing with very incomplete information. So some questions to ask yourself when you're thinking, do I pay cash or do I finance something? One is, if you pay cash, what does that do to your liquidity? Have you planned out your income floor? And if it zaps all your liquidity, it puts you in a little bit more vulnerable situation if something else happens. You don't want to do that necessarily. If you pay cash, what are the tax ramifications of coming up with the cash? Do you have to sell highly appreciated assets? Do you have to take it out of an IRA? That's going to be a tax drag on that. How does that impact the decision relative to the interest costs that you have? What is the opportunity cost of that money? If your RV costs $50,000, what could that $50,000 do otherwise? So I guess in the sense of my home remodel, my $50,000, we'll use that number, was earning 0.5% in a money market. And my plan wasn't to invest that in longer term assets that could potentially earn more. So it was, I'm earning 0.5% here versus paying, let's say 3% over here. The opportunity cost was easy. It's probably easier just to use the cash. I'm not losing market returns or investing in my business or what have you. What type of asset is it? Like in your case, GC, you're buying an RV, and depending on how you're buying it, new or used, it's a depreciating asset. Usually those aren't things you want to use leverage for. And then lastly, what does your gut tell you? These are some things to think about to hopefully give you a framework to figure out what's right for you, because there is no actual quote unquote right decision. So hopefully that helps you. And if you have some hints, share them with me, either reply in 6 Shot Saturday or shoot me an email at rogerwhitney.com/askroger, and maybe I'll share them with GC and everybody on a future show. Now let's get to Phil's question on renting in retirement.
I've been listening to the show for about a year now, and I really enjoy it. I've heard mentioned a couple of times that one should consider renting instead of buying when checking out a new area. I think this is a great idea. My question is, what are the issues with the renting when you no longer have an income? Don't most rental places want to do a credit check on you and see that your rent is like less than 30% of your income? What happens when your income is zero, at least officially, and you're living off your savings? Thank you very much. I hope to get a cool answer.
A cool answer. Hey, of course, it's a cool answer, right? No, thanks for the question, Phil. Good question on renting. And this parallels to how do you buy a house or get a mortgage when you're retired. Luckily, Phil, it's become much easier, even the last 10 years, simply because there are more and more people in this situation. As the baby boomers age, they have sort of dictated services really for the entire timeline of the generation because it's such a massive boom of people. That's why it's baby boomers. So the process has become a lot easier. When you go to a mortgage company or you go to a rental office, you're generally dealing with a very big corporation. And if you're dealing with a corporation, they want efficiency, so they have models, right? They get the credit report, they want to see income, and they just plug it into the model and it says yay or nay. And that's usually been the issue that you're talking about in dealing with this. So luckily, because more people are retired, getting mortgages and renting, and it's such a huge market, you may have to go through a little bit more manual process. You're going to go through that. They're going to realize that you are retired. They're going to still want documents. Usually they're going to want the credit report. Obviously, they're going to run a credit report. They may want account statements. They may want letters from your advisor or your CPA stating that you can easily support this income. They may want to see the income sources you do have, whether that's Social Security, annuities, dividends, etc. They're just going to want a little bit more documentation, and generally it can be approved manually by supervisors that are outside the statistical model to approve you. And I've not had an issue. I've had to write some of those letters and provide some of that documentation in my career with clients. I haven't really ever had an issue where someone was just refused. So I think you're pretty okay there. You just may have to do a little bit more work and make sure you're talking to actual humans that will look at the entire picture and not just the statistical model. So hopefully that's a help there, Phil, and hopefully that was cool enough. With that, let's get to our SMART Sprint for the week.
On your marks, get set.
And we're off to set a 7-day baby step that we can accomplish in 7 days to rock retirement. I always mess that up. So this concept of jump, I was having a conversation with someone else recently who received a package, had accepted it, and they were 6 or 7 months beyond retirement. They've already retired. And what they said was, had I not got the package, I probably would have gone a few more years, not because I needed to, just because of the fear of jumping. And they were so glad they got the package, not because of the money or the health benefits, or not that that wasn't bad. They were so happy because it forced their hand. That's awesome. Sometimes we do need to be pushed, not jumped. And we're going to talk about premature or accelerated plans for retirement all next month, whether it's forced upon you by a RIF or a furlough, or whether it's a package that is too good to be true or gets you moving. So we're going to talk about all that next month. But in the next 7 days, I want you to think about this hang gliding metaphor and just check yourself to see if you've done all the prep that you need to do, and is it just that fear of running and jumping? I think it's important to acknowledge that if it is, not a bad thing, but it's a step to acknowledge it so you can figure out how you deal with that. I've been asked a lot about Nicole, and she will be back on in the next week or so. She's working. I think I mentioned this last week, but I was thinking about it again because I keep getting asked. And she's going to be on the show, and we're going to have some special guests on. As always, if you have any feedback for the show, you want to say, hey, Roger, stop saying that word. Please, Roger, sing again. You can go to rogerwhitney.com/Ask Roger, or you can just email me at roger@rogerwhitney.com and give me your thoughts, give me your feedback. We'd love to hear it because this show is about you and you rocking retirement. Hope you have a great day. Hey, it's time for that all-important disclaimer. We so appreciate you listening to the show and love your questions and love the teaching that we're able to provide here. And actually, it helps us too. But remember, you're not our clients.
Not love it if you took advice from us on the show.
We would not love it if you took advice from us on the show. Realize it's helpful in education. Talk to your legal advisor, your tax advisor, or your financial advisor before you make any decisions.
We appreciate you joining us today for this episode of Retirement Answer Man. Be sure to visit rogerwhitney.com/answers to access the Retirement Answer Library with over 30 checklists to help you make the most of the only life you have. Remember, you have more power than you realize to create an amazing life starting today with Retirement Answer Man. The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. All performance referenced is historical and no guarantee of future results. All indices are unmanaged and may not be invested into directly. Have a wonderful day.